In Arizona, there are only 4 carriers that offer FIDE D-SNP plans. United Healthcare is one of them, Banner, Mercy Care, and then WellCare, or known as Bizway or Arizona Complete Health. Those are the only 4 carriers that offer D-SNP for long-term care folks. So, for example, if someone's enrolled in United Healthcare and they want to enroll in Banner, then they're not able to do that. Now, there are some changes in the first quarter. You were able to change that their long-term care plan. Right now, it's somewhat restrictive. It depends on who you talk to when you call access. But this is something that they're kind of in a situation where they can only be in that particular Medicaid plan's D-SNP. In the previous year, you had United, Banner, Mercy Care, and WellCare. That were all the carriers. And then last year in October, United and WellCare were supposed to have the long-term care contracts, but there was a court order that permitted a stay. And so that court order that court case has been finalized. And what's going to happen in October is that these 4 carriers will continue to have long-term care contracts. So your client might get a letter if you have someone that's in long-term care. They might get a letter in July saying that they're going to be enrolled into this particular long-term care carrier and Medicaid. And so they have the ability to make a selection that whole month of July. And then that plan that they chose is going to become effective in October 1st. So the plan year for, just in another nugget, the plan year for Medicaid goes from October 1st to September 30th versus the plan year for Medicare is from January 1st through December 31st. So there's a little bit of difference in the two programs. Now, if you are enrolling someone in a dual special needs plan, if you look at the attestation, you're going to see what's called the integrated SEP, and it says I have Medicare and get full Medicaid benefits, and I want to switch or join a plan that coordinates coverage between my Medicare and Medicaid managed care plans called an integrated dual eligible special needs. You'll select that option if you have someone that wants to enroll into a D-SNP. In years past, and even some of the forms that you're looking at, if you have an enrollment kit, because this is new, this SEP, you'll have some of the enrollment booklets I have both Medicare and Medicaid, and my state pays for my Medicare premiums, or I get extra help paying my Medicare drug coverage. If you select this one, we automatically will integrate this one, because unfortunately, this one on a paper application exists, but this is the new one.
That is going to be like
Correct. So you might have a booklet because all of our booklets were printed last year. So you might have a booklet that states, I have both Medicare and Medicaid. But when you go into Connecture, if you want to enroll someone, you might not see this one, but you'll see this. So there's a difference between the paper because it was printed last year, and in Connecture, you'll see the integrated SE. But it's the same type of concept in a way. Now there was a FEMA government. So last year Medicare said, hey, we're going to do away with the FEMA SEP. That's going to go away on April 1st. But they withdrew it. Okay, CMS withdrew it, and in Arizona, because of the limitations of the beneficiaries have to use SEPs, because the only way a beneficiary is able to change is during the Medicare during the Medicare Advantage Open Enrollment, MAOEP, January 1st to March 30th. If they have a C-SNP, they were eligible for a chronic special needs plan, or if they had a change in their Medicaid eligibility, that's pretty much. And so in Arizona, a lot of beneficiaries, a lot of agents were getting excited because the president signed an emergency declaration and so a lot of agents were thinking, oh crap, I can use this SEP. Medicare said, starting April 1st, you can no longer use the FEMA disaster. And because what happened is that CMS was seeing that a lot of agents were abusing this. They were selecting this disaster when the beneficiary was not really impacted by emergency disaster. But this is what has been withdrawn, so agents are still able to use this disaster SEP or FEMA, SEP. But I always want to give agents the information that unfortunately, if you use the FEMA SEP, your NPN is going to be tracked because CMS wants who's submitting the FEMA SEPs. So in years, CMS would ask us how many FEMA SEPs did you receive. And we would tell them 15, 20, or whatever, however it was. Now CMS says, okay, we want the NPN of who's submitting those applications. So I always tell you, don't bring any attention to yourself. If you have a client that was impacted by this, especially with the fires, you know what I mean, that's happening up north, you know, they wanted to make a change or they moved, you know, you can always use that. Don't abuse it. So, you know, and if you do, don't be, your NPN is being tracked. You don't want to be, you know, Agent Smith here submitted, you know, 200 FEMA SEPs, and the state of California only submitted 5 or 10, or North Carolina, which, you know, are impacted by natural disasters, they only submitted a handful, but yet, you know, we have. So just wanted to share